Thank you for everyone in the audience for coming to this important topic. So, a brief introduction. Rosa DeLauro is the Congresswoman from Connecticut's 3rd Congressional District. Representative DeLauro serves in the Democratic leadership as co-chair of the Democratic Steering and Policy Committee, and she's the ranking member on the Labor, Health, and Human Services and Education Appropriations Subcommittee. That word appropriations is very important. She oversees our nation's investments in education, health, and employment. She also serves on the subcommittee responsible for the U.S. Department of Agriculture and the U.S. Food and Drug Administration, where she oversees food and drug safety. I had the pleasure of spending time with Representative DeLauro in her office together with Josh Sharfstein and 2 students, where we spoke for a long time about the issues of migration and the border. She's passionate about what is happening at the border, as you may have read, and she's also been an extremely strong public health advocate. Representative DeLauro, are you able to, everything fine? Are you able to hear and see us?
I can see the audience, which is great, and I can hear you, Professor Spiegel. I can hear you, yes.
Wonderful. So thank you. We have an audience that is growing as we speak. I'm going to ask you some questions, and we look forward to hearing what you have to say today. But thank you again for coming.
Thank you so much. I can't tell you how honored and excited I am about being with you, Professor, and thank you. I want to thank Dr. Sharfstein and all affiliated with you for the great and outstanding work that Bloomberg does, the School of Public Health does, for your focus on this issue, oftentimes which doesn't get, in my view, the kind of attention that it needs. And you shine a spotlight on something that is critically important. And I'll say at the outset, a policy, if you will, which I don't really believe the United States can really be proud of this policy with its regard to unaccompanied children.
Thank you. So my first question actually relates to that, is that your committee has an enormous reach across labor, education, and health, yet you yourself have focused on the conditions at the border. Can you tell us why this is a matter of concern to you?
Certainly, I'm very, very, very happy to. What is often not understood and not known is that the Department of Health and Human Services has under its jurisdiction the Office of Refugee Resettlement, ORR. That agency is responsible for the well-being of unaccompanied children who come across into the United States, who come on their own without a parent or with a legal guardian. I'll say 2 things. Oftentimes, when we deal with this issue of the border, people think about the Department of Homeland Security. The Department of Homeland Security deals with apprehending the children at the border. They are supposed to be held for no longer than 72 hours with Department of Homeland Security, and then transferred to the Department of Health and Human Services, to the Office of Refugee Resettlement. So in essence, HHS, ORR, this is a child welfare agency. Department of Homeland Security is an immigration enforcement agency, not to be confused. Now, I also a footnote here that when children came with their parents or with a non-parental guardian, like an aunt, an uncle, grandmother, grandfather, and we had the policy of separation of children at the border. When those children were separated, they became unaccompanied children and added to the numbers who, in fact, do come unaccompanied with no parent and no guardian. So I have direct jurisdiction over this agency and what it does with regard to our to children coming to the United States. And as you pointed out, I am on the Appropriations Committee, and the utilization of resources, of funds that are appropriated for being able to take care of this of these children. This is a matter, in addition to the oversight responsibility that I have been singularly focused on this issue from a humanitarian point of view. Why? Because I believe that these children who have come unaccompanied or who were separated and they were entrusted in our care have suffered greatly. And I believe further that this, and the way I characterize this, and the treatment that they have received as government-sponsored child abuse. These are the most vulnerable, the most sensitive of children coming into this country. And what has happened in this program has created serious trauma, toxic stress, mental health illness amongst these children. And I believe as well that the crisis was deliberate and that some of the policies that were carried out by the Office of Refugee Resettlement only added to the increased numbers of children in detention. I will go on to explain if that's what you want me to do at this juncture, Professor Spiegel.
Please do. No, please do, yes.
Okay, thank you. What I did early on was I asked the Office of the Inspector General, this was back early in the year, to provide a briefing to all of our subcommittee members, that's Democrats and Republicans, no press, what was happening with these children. And what they told us was really quite extraordinary. That in addition to the children that were separated when the zero tolerance policy was enacted, several thousand, that we began this process of separating families in 2017. And to date, we have not identified all of these children who were separated. It was a policy, and General Kelly, when he served as Chief of Staff to the President, so stated that this was a policy enacted in order to deal as a deterrent. If you separate children from their families, what greater tragedy when you pull families apart like this, that in fact would deter people from coming to the United States. So when I say it was a manufactured crisis, I mean, we decided on a public policy that separated families, that put children into detention, as well as the already thousands of children who come unaccompanied to the border. With that, we then, what the mission of the Office of Refugee Resettlement is to provide a safe placement for a child in as expeditiously an effort as possible. Make sure that it is safe placement, but move as quickly as you can. With the policies that were enacted with the Trump administration, where the average length of stay for a child was around 35 days, it spiked up to 93 days. Some children were more than that. 4, 5, 6 months. Really staggering. What the Office of the Inspector General told us, that the policy choices that were made by the agency creating this mental health crisis with children, that this is, I'm going to quote their report. They released this report in September. Policy changes in 2018 exacerbated existing challenges. It resulted in a rapid increase in the number of children separated from their parents after entering the United States, many of whom were younger. And there were longer stays in ORR custody for children. And all of the data from the American Psychological Association has pointed to the longer stays created a traumatic environment for these children, and children who were continually faced with toxic stress, which has a long-term, both mental and physical bearing. And it's not just as a child, but that continues with them for the rest of their lives. I want to point out one thing on the separation. And that's not the only issue here, because it is overall unaccompanied children. You know, and I say to the audience there, you go to a restaurant, you check your coat. They give you a claim check so that at the end of the evening, you can retrieve your coat. You put your luggage in storage. You get a claim check. So then you're ready to pick it up. They can identify it and you can get your luggage back. My friends, there was no claim check for these children. On the separation policy, understand, they had no system in place to link up children and their families. It was through the good offices of the ACLU, which took charge of the process, which is still existing, to help to identify parents and children. It is true that there may be some children who will never be reunited with their families. That is a tragedy, and it is on our watch. When I talk about the part of my oversight responsibility, it also has to do with the resources. When the Department of Health and Human Services and the Department of Homeland Security asked for $4.5 billion for a supplemental bill because they said the numbers of children coming across the border were substantial. And in fact, they had to create bed space for them. They didn't have bed space, and they were choked off at the border. $2.9 billion of that money was for the unaccompanied children, where, as I said, I have jurisdiction, that they needed additional money to do that. What they had been doing in the past was transferring money from programs like universal flu vaccine, from the National Institutes of Health, from the Head Start program, from the Low Income Energy Assistance Program, Elderly Falls Prevention Program, Center for Disease Control, etc. And the issue around that, and we did provide them with the funds, but why there was such a controversy about this is because, and I'll speak, I was at the center of it. I said to them, you can have this money. However, when these children are in our custody, there needs to be standards of care. Standards of care as to how they are treated when they are in our custody. And at this time, they set up a place in Homestead, Florida, which was what they call an influx facility. It is unlicensed. which means that they do not have to follow a protocol of standards of care, where children are warehoused. There were several thousand children there. We found at other places, like the one in Texas, where they were not even vetting the personnel taking care of these children. Our point was, yes, we need to house them, but what is your plan for discharging them to a safe placement with a licensed facility or in a foster home where there are standards of care? And what are you doing, not only to detain them, what are you doing to discharge them? In December of last year, we had 15,000 children in detention. And I'm going to tell you why the Inspector General talked about their policies. If one of you wanted to serve as a sponsor for one of these children, you came forward. If you were undocumented, by virtue of an agreement between the Department of Health and Human Services and the Department of Homeland Security, they signed a memorandum of agreement which says that HHS, a child welfare agency, and DHS, which is an immigration enforcement agency, would share information. You come forward as a sponsor, you are undocumented. HHS reports that to DHS, you are deported. That happened over and over and over again so that they dried up the pipeline for people coming forward to say that they would take these children on. For those children who had family, normal practice had been, even under the Obama administration, is to fingerprint so that you knew that the child was safe. What they said and what they put into practice was they not only fingerprinted the sponsor, but they then said that there was a policy of fingerprinting every single person in the household. That almost ground the process to a halt. 15,000 children in detention. And I will say, to their credit, what HHS began to do is to say, okay, we are not going to fingerprint everyone in the household. By virtue of that one requirement being rescinded, they told me this first, that over maybe a 2-week period of time, that they were able to release 4,000 children. That then they corrected themselves and told me they were able to release 8,000 children. So that when the Inspector General says that their policies exasperated an already difficult situation, if they could release these children to a safe and expeditiously possible placement, there was no need for there to be a chokehold at the border. They could have been, there's no question that there were more children coming across. I will acknowledge that right off the bat. But if they had a process which was not only detention, but one that dealt with discharge, we could have avoided a very big part of what this problem was. But more important, we could have fostered the health and the safety of these children who are in our custody, and that we have a moral responsibility for taking care of, and that we have standards of care for taking care of them. Now waiting for the Department of HHS, ORR, to provide us with a discharge plan and what they plan to do. We now know that there are no children left at Homestead. My goal is to shut this kind of a facility down. We need to only be putting children in licensed, registered facilities that have a protocol of standards of care. But you should know that while there are no children at Homestead, the facility is still open, and that the federal government is paying about not $750 a day per child, which is what they charge us. These are taxpayer dollars. Gives you some reason why they might want to be holding children longer. $750 a day per child. But now, even though there isn't a child there, we're now being charged, it's like $600 or $650 a day. Why? That shouldn't be. That's why we have to move to a humane system that, yes, accepts these children, takes care of them while they're in our custody, and in the shortest possible time, get them to a safe sponsorship, to a foster home, and discharged as quickly as possible. And many of these children have parents, they have aunts, uncles, family in the United States, and they could be moved quickly to these placements.
Representative DeLauro, firstly, thank you. It was very comprehensive. Two questions as a follow-up. Number one is, what has been your interactions with the Center for Disease Control? You've talked about standards. Number one. Number two is that a lot of the problems are also, or many of the problems, the most egregious, are on the DHS side, and particularly CBP, Customs and Border Patrol. And we've spoken to you about where they've clearly said they're not going to be providing flu vaccine, amongst others. And I know that you've worked with Congresswoman Rosa Allard, but what can you do, and what are you planning to do in that issue?
This is very good. Look, I cannot say this was. I've been to the border. I've been to the border several times. I've been to Homestead, and I was at the border in McAllen, Texas, and literally children were in these very high cages, and with just crammed together. At the DHS, when we saw them at the facility there, which gets to the point on the potential for illness, we saw them in the detention cells with Department of Homeland Security. And again, they're only supposed to be detained for 72 hours there. But they're in these small cubicles and really just packed with kids. Now, these are hot climates. So the children come and they've, shorts, T-shirts, etc. These rooms are freezing. The Spanish word is for them are la helera, is in the cold. They have thin mylar blankets. It's mylar. It looks like a sheet of tinfoil, but it's mylar. It's pliable. And when I saw them there, I actually saw the first one. My colleague, Congressman Jim Hines from Connecticut, and we saw them. There was like a sea of mylar. When they began to hear voices and talking, honestly, if I can describe it, the mylar began to move. And so, out from under it popping all these youngsters, who were, cold, rubbing their arms because they were cold. It's a cold environment. Long and the short of it, they are in close quarters, both with DHS and with HHS. When we did go to Homestead and visited Homestead, at that time, there were about 2,700 children there. So they are in close quarters with one another. And there is the fear that what this generates in terms of illness. So what we have done, Congressman Roybal Allard, by the way, is from California. Like I chair the Appropriations Committee on Health and Human Services, Congresswoman Roybal Allard chairs the Appropriations Committee on the Department of Homeland Security. So we work pretty closely together all of the time. And our concern was that it was brought to our attention, and again, as I say, not surprising, that the children were not being vaccinated. And we saw the incidents, I believe it was, and these doctors brought this to our attention, that the disease, infectious disease, inside of the detention centers. So we had the death of at least 3 children. So we wanted to see that the children were getting flu vaccine when they entered the country or when they were apprehended. But Customs and Border Patrol has apparently taken the position, and this is what we were told, that the agency would not be offering influenza vaccines to detainees or requiring vaccinations for staff for the 2019-2020 flu season. So what Congresswoman Roy Ballard and I did, and we both wrote to them, I've written to them, what we have done is, given that the CDC is the nation's leading agency on infection control, it supports vaccination against influenza. I can't tell you, you must get them. I get the number of notices that say, did you get your flu vaccine shot? And that this is preventive. Well, in any case, we have not yet heard back from the Center for Disease Control about what their intention is here. But what we have said to them, we've asked them questions, and I'll tell you what those questions are. This is what first they said to us. Because CDC has personally encouraged vaccination in detention centers, in a recent interview after a Research American forum, you were asked if you advise the Customs and Border Patrol to give flu shots to detainees. And this is Director Redfield, Dr. Redfield at the CDC. This is what his response was. We don't tell them exactly how they need to operationalize it. We do believe that vaccination, particularly as early as possible, is a recommendation. You also so stated that, quote, as soon as we get individuals, all individuals, whether they're citizens in our nation or whether they're migrants, to get the flu vaccination is something that we do recommend. So we've asked them a series of questions, and we've asked them CDC about their consultation and the documentation shared between the two agencies and email messages. We asked what the guidance has been between the two agencies, the nature of that guidance, and we said, provide us with all of the copies of communication and email messages in regard to these efforts. And as far as I know, we have not yet heard back from them, but we're going to continue to follow this. Congresswoman Roy Ballard and I are committed to this.
Great. Thank you. Thank you very much. Perhaps the last question, because I think I know you have to leave, is what would you recommend faculty and students at Johns Hopkins and other places like Johns Hopkins do to advocate for public health interventions based on evidence in circumstances such as what's happening?
Go ahead, finish it.
In circumstances what's happening where migrants are being held in U.S. government detention in such conditions, and as you've intimated, both international and national standards are not always being followed in these areas.
Yes, I mean there are protocols. We have the Flores Agreement. It's not a law, but it was a settlement in 1997, which lays out very, very specifically the standards of care that need to get followed. And what we try to do, and I was unsuccessful at this when we provided the emergency supplemental funding, we could not get, and I voted against that package particularly because we could not ensure that the standards of care as laid out, they would not allow them, we couldn't get a vote to have them required. We could have gotten that vote in the House of Representatives. We were unable to get that vote in the United States Senate. So as I said, I did not vote for the package because I felt that we were we're just not doing the right thing in safeguarding these children. But there are protocols. Even the Department of Homeland Security has protocols as to how these children are supposed to be taken care of, even for that limited amount of detention. And I believe that we could, in the House of Representatives, that we can address the problems at the border. I don't believe we have that same opportunity. And that's because, I'll be very frank with you, that's because we're in the majority. And however, the support's not there in the Senate, so that we are left at the moment with status quo, except we are working diligently with the agency on making changes, and they have made changes. I mentioned the fingerprinting one. They are now looking at placements with siblings, with aunts, uncles, grandmothers, grandfathers. They weren't doing that in the past, so that they could move the children along. One of the big problems that we are going to have, and I'm alerting you to this because I want to ask you to do something as well, in the 2020 appropriations bill, which we lay out some of these pieces, the administration has shortchanged the Senate labor HHS bill by about $5 billion to hold that money for the wall that the president wants to build, so that money that could be coming overall to all the programs that we cover under labor, health, and education. At the moment, we haven't concluded the process yet. They are shortchanging. What can you do? You are a school of public health. All of you there are spending your lives in a professional career that deals with the public health of this nation and of others. Doesn't stop at our border. Obviously, you can call or you can write your members of Congress, but you are health experts. You get these issues, you understand them, you know what infectious disease is all about, you know what the effects of trauma and toxic stress are on whether it's a child or whether it is an adult. You need to stand up and write the op-eds, deal with press on your own, gather together, get to others around the country that are in the same profession. Organize yourselves as a vanguard to make sure that we are safeguarding the health and safety, not only of the children in our country, but children who are entrusted to us by law, however they get here. Your insight, your expertise is critical. You are evidence-based. When I speak up, often they say, well, there's Rosa DeLauro, she's a partisan and nothing, she was, look, I was said that I was holding up the money. Wasn't holding up the money. Tell me how you're going to discharge these kids. Tell me what your standards of care are. And then we'll provide you with the money. You can talk about evidence-based practices, best practices, so your work is critical to where we go on this issue. And I implore your help.
Well, thank you. I'm just going to point to me just to say, Representative DeLauro, thank you so much. I don't know if you can see me. Thank you so much. Your passion and your passion and your commitment is really extraordinary. So you.
I don't know if people have any questions. I know it's limited.
Do you have time?
I'll answer one or two questions. I'm happy to do that.
Okay, great.
It's important. This is an important issue.
Do you want to take over? No. So great. If we have one or two questions from the One or two questions, briefly from the crowd. This is your chance. Go for it. Catherine, go ahead.
I'm just wondering, we know what the
I'll repeat
problem
it.
is.
I'll repeat it.
We know what the problem is.
Oh, good.
Hi, Representative DeLauro. So I know you spoke a lot about what the problems are and stuff like that. How can we ensure that we hold these agencies accountable, whether it be OLR or DHS or even CPB? Is there a way that we can utilize funds? Is there like passing of a law or something that we can do? Or how can we aid in that process? Because it just seems that a lot of problems are coming up and we're bringing these problems up, but we're not holding them accountable.
Well, it's an excellent question. We began to shine a light on the policies. All we kept hearing was that, we've got the influx of kids, We need to get more beds. We got to house them. There was a facility with 3,000 kids in Texas, which, as I said, we wound up shutting down because of oversight. We have a moral responsibility to deal with the oversight. If you can't get people to support that effort on the humanity of the issue, then let's talk about taxpayers' dollars and what's being spent. But it is about keeping the agency's feet to the fire. And look, I'm not there every day at the agency, but we now have had 3 hearings. One was an informal one to hear about the information. I've had 2 subsequent hearings on what the effects are, and then the second one was on the effects, and the third one on what the mental health concerns that have risen because of these policies. When that begins to see the light of day, then you have the pressure on the agency to do the right thing. But it's not just well-meaning people on the inside of the institution, it's the external pressure on the agencies. You are the external pressure as well. What we tried to do, and again, I was not successful. I can tell you where I can win and where I don't win, was that what we wanted to do is to say, if we found any of the grantees who operate these influx facilities, that they were not following the standards of care after we reviewed what they were doing, that in fact we would revoke their license and they would not be able to serve in any of this capacity again. We built that in. We could not get a vote to say yes on that, to agree to that. It was in the House bill, which we passed this in the House overwhelmingly. We could not get it in the bill in the Senate. Frankly, Senator McConnell said he would not take up the House bill. So it's vigilance, it's activism and oversight so that they cannot do what they're doing out of the public light.
One last question, Alia.
Senator Rosa, thank you for your time and coming to speak with us. It is so hard, as you've alluded to ensure that appropriate standards are being met. And undoubtedly, the best place for children is not in detention centers. Have there been any efforts to push for alternatives to detention with children so that they aren't placed in these centers in the first place? Like, for example, reinstating the family case management program?
Sure. It's an excellent question because let me, and in all fairness, ORR overseas, I think it may be 123, something like that. I may be wrong on the number, but a large number of licensed facilities, shelters, and we want to move the children out of those shelters as quickly as possible, but they are state licensed. They do have to follow regulations. There's a much smaller number of children who are there. They are not warehoused, so the care is more individualized. So in fairness to HHS, but my view is that's the direction we should be going in, is not putting together these large influx facilities and I would say we've had really some success in this, is we closed down Tornillo in Texas. There aren't any children now at Homestead. The agency was planning to go to Fort Sill in Oklahoma to offer another. They are no longer going to do that. I'm saying this to you publicly because I've said it to them. My goal is to shut down the influx facilities so that when we're getting children coming across the border unaccompanied, that we have in place state licensed shelter facilities, opportunities for foster care in which these children can go and be taken care of. And we need to monitor that process as well, but it is a much healthier environment for our children. I want to say a thank you to the advocacy organizations that are out there, whether they are nonprofits or religious organizations who we work with all of the time, and who are on the ground, and who are the people that we work with and who I spoke with and when we were trying to put together the kinds of standards or what we should put in place, and with the money that was being asked for with that supplemental emergency funding. And so what we have put in place is more funding for case managers, for field specialists, for legal services, for more medical services. And we have put that into what they need to do with the funding that we have provided. And that's the use. And for the last question, we try to curtail, we hold them to the specific use of that funding.
Great. Thank you so much, Congresswoman DeLauro.
This is
Josh Sharfstein. Yes, very good to see you. And we just all really appreciate your leadership on this issue, the great work you and other members of Congress and your staff are doing. And thank you so much for joining us this afternoon.
We can't do it without you. I appreciate all of your efforts and advice in this effort. I'm sorry I couldn't be there in person, but I'm so delighted to have the opportunity to be with you and with your great students and faculty and people who really care about health and public health in this country. Thank you.
Thank you. Great. Have a wonderful day.
Thank you.
There we go. Okay. Excellent. Well, good afternoon, everybody. I'm Josh Sharfstein, the Vice Dean for Public Health Practice and Community Engagement. Thank you, Dr. Spiegel, for great interview with Congresswoman DeLauro, who some of you may know we've been working with over the last few months around some of these issues. I want to call up a few people who are going to help us process what Representative DeLauro said and provide their own perspective. So Tanya Caballero, Angel Silva, great, and Catherine Narvaez. Come on up. And we'll also have others speaking as opportunities are there. And we have about another half hour, so we have some time, but I want to make sure there's also some time for discussion. I think we'll start with you, Dr. Caballero. You are a pediatrician very involved in care issues for children generally, and particularly Latino children, and you've been involved in some of the border issues. So maybe if you could, having heard that, give just your brief initial thoughts before we open up to discussion.
Sure. Okay. Hi, everyone. Thank you so much for your interest in this. So as Dr. Sharfstein said, I'm a general pediatrician. I see patients over at the Children's Medical Practice at Bayview. Bayview is on the east side of Baltimore, and we have a very large Latino community, mostly consisting of immigrant parents with U.S.-born children, although we do see newly arrived former unaccompanied minors as well in our practice. I'm involved with the American Academy of Pediatrics. I'm on the executive committee for a committee on child and Latino child and immigrant health. And so we work very closely with the advocacy that Representative DeLauro has worked with as well. And I think, so a lot of what she's talked about, it was exciting to hear her be so passionate about it, because it's a lot of what the work that we're doing also on the advocacy side of things. I think that it is a complicated process, and I think that one of the things that we particularly see on our side when we receive some formerly unaccompanied minors is, there's a lot of talk about toxic stress and the experience during detention that's occurred, but a lot of times that's sort of a drop in the bucket compared to what they've experienced in their home countries before even getting here. And I think that it's a great and really important piece of information that has really driven a lot of the public attention is the stress and long-term mental health effects on these kids. But what we see too is sometimes, I've had some kids come from facilities in Texas and Florida, and they say, yeah, everything's fine. Yeah, I mean, they weren't that nice to me, but it's fine, I'm here. And then it's really over time that we really start seeing some of the difficulties in assimilating, difficulties reconnecting with family members. And so I think there's really important work to be done for policy changes as well, but also for those of us who are here and interacting with some of the immigrant communities here, we have to also keep in mind that, a lot of the effects, because they're long-term, can manifest as different things. We see a lot of anxiety, stress, depression, that kind of come out over time. And so I think that that's also an important thing to think about, is that no matter sort of what happens with the policy changes now, we're going to be seeing those effects over time. So I think that's where I would start, and encourage you guys to become involved too as mentors and things like that, which could really help a lot of these kids who are coming here looking for ways to participate and be a part of this new community. They've worked so hard to get here.
Great, thank you. Mr. Silva, would you are an educational consultant and have spent some time at the border. Could you give a little bit of your background, your initial thoughts?
Absolutely. Good afternoon, everybody. My name is Angel Silva, and I'm a undocumented unafraid standing here in front of all y'all today. As Josh just mentioned, I am an educational and nonprofit consultant, having worked previously on Capitol Hill through internships and helping folks enter into these environments, and also having worked with undocumented students in California. A lot of what Congresswoman DeLauro said resonated a lot in the sense of my experience at the border. About 6 months ago, I was part of a group through the Hispanic Heritage Foundation that had the opportunity to visit a couple of cities at the border. We went to McAllen, which is right across from the border, from the city of Reynosa in Mexico, and Brownsville, which is on the opposite side of Matamoros. And a lot of what we saw there it was surprising to see how much of it was normalized, how much this idea of, oh, this is a border, this is general life. I remember landing at the airport in McAllen and seeing a Border Patrol car, like one of those like white and green cars, and thinking, oh, I'm in Texas, I'm in the border. And then realizing I probably shouldn't be there because, feeling like I shouldn't be there because we had this like internal, like, as an undocumented person, I had this internalized fear of, oh, this is an entity that is here to not in our favor. So hearing the Congresswoman talk about the effects of children in these environments, the effects of subpar conditions, and how damaging they can be for mental health of folks, and then experiencing some of that firsthand, it was a bit of a difficult experience to go through, in the sense that if I, as a 27-year-old, am having difficulty parsing through these environments, can you only imagine what it must be like at 4, 5, 6 years old, coming into an environment, first of all, that you're not familiar with after leaving whatever you had encountered in your home country behind. Second of all, being removed from your parents' custody. And third of all, being put in this unfamiliar environment where you have folks that are not sympathetic to you in any way, shape, or form. And this is something that is not limited to not limited to like the border conditions themselves. This is something that permeates, it's an entire culture. You have folks like Sarah Fabian, who is a senior litigation counsel for the Department of Justice under the Immigration Litigation Department, who back in June argued, oh, we don't need to give these kids toothbrushes. We don't need to give them these kind of things. And she argued this at federal court, making the case like, oh, these are not services that are necessary to human survival. These are not services that are necessary to making sure that people have, humane conditions or whatever. The fact that we have a federal employee making these kinds of arguments in a federal court just goes to show you how much work there needs to be done to root and how much of this is at the root of the kind of immigration policies that we're seeing nowadays. So we have our work cut out for us, to be completely honest. It's not something that, it's not an ideal situation to be in.
And when you were down at the border, did you meet with families who had been in, or children who had been in custody? What were you there to do?
We were there as, so the fellowship that I was doing was in part and parcel to try to connect with folks that were doing meaningful work at the border. So we met with Sister Norma, who runs a nonprofit down there, and heard her talk about her experiences in helping folks navigate these environments for the first time. And just hearing the stories about like how mistrustful folks were when it came to, what do you mean? We can talk to somebody about our issues. We can talk to someone who understands what we're going through. Just that level of distrust stemming from all of the experiences that they've had. And this is someone like decided saying, "Hey, I'm willing to go and help you out." And just like having her talk to us about like the stories of separation that she encountered as the leader of a religious nonprofit focusing on reuniting families and providing them services once they are in the United States.
Just how difficult it is even for her to...
Exactly. Like she teared up in our conversations. We did too. We were just like, this is the real cost of having humane policies towards migrants, towards folks that are coming over here to the United States, fleeing from something that has roots that are not connected to you. And it's just like, these are experiences that they will have to carry throughout their entire lives. And these are experiences that Sister Norma will carry through with her throughout her whole life. And these are transformative experiences. So I want to reiterate what the Congresswoman said in terms of a call to action, that we have to be cognizant that we have the privilege to actually be in these environments, and we have to be able to carry these stories on forward and just, provide the services that are required to make families that are coming into these environments feel safe, feel nurtured, feel like they belong, because we do. And
thank you.
And that's all they would have done.
Great. Catherine is one of our MPH students, and I know you've been doing some work at the border as well, and you had a chance to meet with Congresswoman DeLauro in her office. So tell us a little bit about your work and your reaction.
Well, for me, I think it goes just beyond seeing it. Like, I've actually experienced it, and so for me, it's very, very personal. Does everybody know what DACA is? Deferred Action for Childhood Arrivals. So I was actually granted DACA back in 2012 when Obama made an executive decision. And so for me, with these kids, that was me 15 years ago when I was crossing the border, seeking a better life, being put in detention centers. And, at that time we had a catch and release. So we were detained for maybe a couple of days and then we were released, but we never separated from our parents. And so just even that traumatizing experience and how that can be, tenfold or even 100-fold for kids who are 2 or 3 years old. And if you think about it, there was a video of a little girl who couldn't remember her mom because it was so long before she could see her mom again that she didn't recognize her mom. And when you're that young, just imagine how traumatizing it is to be put in that situation and then meeting again somebody that you haven't kept in contact with for a long time. And so working with, I can tell that Representative DeLauro is very passionate about this, and I'm very extremely thankful because in my community where I come from, these are things that are so, it's it just happens. We have people who, when they were separating kids at the border, they would come to the Guatemalan consulate where I was volunteering at, and then the U.S. government would tell us, you need to help us match these parents and their kids. So something as DNA testing or something like that, something that the Guatemalan consulate had nothing to do with, but we're being asked to provide DNA testing so that they're able to match their kids. And there's still a lot of kids. I have one friend of mine who had a 16-year-old brother coming over, and to this day she doesn't know if he died at the border, if he died crossing over, or if he's in detention center. Obviously he's a lot older, so he should be able to speak. So even to this day, like, just living with that anxiety. So I think even talking about the anxiety that the kids feel, like, imagine being a family member on this side and having absolutely no power to do anything to help them. Because if you came forward, a lot of people would come and ask us, they're asking for sponsorship, but I'm undocumented. Like, do I claim my little sister? Do I claim my little cousin? Do I claim whoever it is? I'm the only family member here. And then realizing that the moment that you come forward, what does that mean for you? So the level of stress that it also causes people on this side of the issue. So, even when we talk about the standards that detention centers are supposed to have that are not being met. So when we analyzed the standards across all international organizations and even CPB and detention centers, they pretty much all match across the board. You're supposed to give people shampoo, you're supposed to give people toothbrushes, all these things, yet somehow that's not being translated within detention centers. Just on October 2nd, we had somebody die in detention centers. So it's something that just is, I guess, is not being worked at the way that it needs to be worked. And so we created this issue, like Dr. DeLauro said, by separating families and then forcing just this influx of kids into OR or detention centers. And then now, even to this day, I think there's a few kids who haven't even found their parents. And so, imagine living a life, for the rest of your life, not knowing if you're ever going to be able to see your parents again. So it's very traumatizing for kids.
Thank you. Thanks to each of you. We put out some really important topics to discuss. I know that there are people here who have direct experience with some of them or insights. So I definitely would like to encourage people, if they want to share anything that they've seen or done. I'm thinking also, Monica, a little bit about your work here in Baltimore, if you are interested. Feel free to raise your hand, and April will give you the microphone. But I think we should talk maybe both about the border and then also about the situation here in Baltimore, a little bit more detail. And Tanya, I want to just start with you. The American Academy of Pediatrics has been pretty outspoken on many of these issues. The president has taken it on personally and been quite strong about it. How through the professional association, how have you seen that gone? What are the next steps in terms of engagement?
For myself or for people who are
the profession, through the American Academy of Pediatrics, or more generally the advocacy agenda for the border, and I'll ask Angel that also too.
I think unfortunately so much of it is the litigation piece. So the Academy has signed on to a couple of pieces of litigation, especially against the upheld Flores agreement, which allows sort of the least amount of detainment necessary for families, so they're not detained for months at a time. Is that sort of catch and release, making sure that people are not in detention for prolonged or unnecessary periods of time. They're involved in that, meeting with ORR, meeting with the organizations, and really advocating for more standardized screening. One of the things that we're worried about is that, for example, I've had a couple of kids who've come from detention centers. They know it was in Florida. They don't know where it was. They were there about a month or two, but they don't come back. They don't, getting paperwork from these organizations as to what immunizations they've gotten there, whether they've been tested for or screened for tuberculosis. These things are really hard to get, so the pediatric organizations, particularly academies, interested in making sure that the protocols are appropriate for pediatric care, things like human trafficking, mental health, identifying chronic illness, and also particularly having trained pediatric providers there, because with the horrible deaths of more than one child in custody, the real pressure from the academy was understanding that identifying children who are ill is very different from identifying an adult who may be sick, and how they really need to be able to have trained providers there to identify an acutely ill child and get them the care that they need. So again, there was sort of talk about, this is the system that we're in. How can we provide our professional opinions through our organizations, partially through joining on to some of the, the legal sort of battles, but also particularly providing and being at the table, saying we're not going to fight, but we want to sit with you and work with you, because what people have found is it's hard. There are a lot of good people in these organizations. They're just working under really difficult conditions. They do their best, but they're really limited. So, reaching out and saying, let me help you do a better job with what we have, and let's try to turn this around. So there's a lot of the sort of clinical focus, and as well as the sort of bigger advocacy focus. And then the third piece is the media focus as well, trying to really put a face on this issue and make it relatable to everybody. So, we all come from families, and really putting a face to this. I think there's sort of across the board an understanding and agreement. This makes everybody feel sad and uncomfortable, seeing children being torn away from their parents, things like that. So really pulling at the emotional piece of things have been really important and helpful in driving a lot of the media changes. And particularly for us too, as primary care doctors, I see children in immigrant families, but what is the standards? They're not a refugee, so they don't get the same kind of screening before they come here. And so what myself and a couple other people are working on updating the guidelines. What do we tell the practice who's all of a sudden seeing a whole, new bunch of Central American children? They've never seen them before, but they're appearing now in their cities. How do they best make sure that they're covering all the issues and the important screening guidelines and tests and things? Right. So we're really trying to help other pediatricians also make sure that they're adhering to standards of care for perhaps a population this is the first time that they're encountering. So there are a lot of different ways that we're really trying to keep on top of this ever sort of changing issue.
Great. I want to give Angel and Catherine a chance to talk about, what the most urgent kind of agenda items are from your perspective for the border, and where the locus of activity is, lawsuits, other oversight.
I had to laugh a little bit at that because there's so much that it's hard to narrow it to just one thing when it comes to the most important thing that we have to focus on. On the advocacy side of things, we're actually lucky to be in. That's actually kind of loud. I need to put it back. We're actually lucky to be in a city, Baltimore, that is very friendly towards immigrants at the local and state level. You have the Mayor's Office of Immigrant Affairs, who has, for the duration of their existence, advocated for the creation of resources for immigrants and refugees throughout the city. You have throughout Baltimore different nonprofits that are focusing on providing services for undocumented folks, for refugees, for recent arrivals, and at the federal level. I love what switch tracks a little bit. I love what Congresswoman DeLauro said in regards to ORR. All that has an impact that trickles down to the states and to the local level. For example, here in Maryland, we have the Maryland Office of Refugees or ASIDs, or MORA for short. Their funding comes from ORR. And if ORR's funding is reduced or eliminated, guess what happens? The Office of MORA can't do what they're meant to do, which is help folks, acclimatize to these environments and adjust to life here in Maryland. So I'm giving this as a background to say that there are things that are happening here in the city and throughout the state of Maryland that are impactful and meaningful for immigrants, refugees, and undocumented folks. But all of this is still endangered because of the current climate that we're in. So what I would say is one of the best ways to actually go ahead and create meaningful change is to connect with folks at the state and local level who are working in government and in policy to continue advocating for these things. Who here knows who their local city council member is? Good, y'all are awesome. Who here knows who their state delegate is or who they are? Okay, a few more, that's good. So it looks like you already have some of the work in mind. These are things that are essential, like meet with these folks. State delegate members are surprisingly very accessible. If you reach out to them and they're not in a session, which is right now, they are more than willing to meet with you, talk with you, and basically, as you had mentioned, provide those kinds of services. Like, say to them, how can I, as someone at Hopkins, provide my medical expertise and tie that to what's happening in the state of Maryland, in the city of Baltimore, with immigrants and refugees. I feel like that's one of the best ways to connect with folks, and doing this in a way that is able to, bridge the gap between policy and public health. Because oftentimes, as Congresswoman DeLauro has said, we have a lot of folks that are entering into these environments, but because they don't have a medical degree or because they don't have that kind of expertise, they're dismissed, even though they're bringing entirely legitimate points to these issues. So in short, honestly, I would say reach out to your city council members, reach out to your state delegates, and continue advocating. Push them to try to make the changes that will help mitigate the impact that we're seeing at the federal level.
Thank you. Catherine, anything you want to add at this point?
Can you repeat your question?
Question was, as you think, what are the urgent issues that can be done for the situation at the border, which is, as mentioned, kind of changing? Yeah,
I think that, Aaliyah's work and Dr. Sharfstein's work, and we worked on a paper about just the flu, something that is, you go get your flu shot and hopefully you're good for the remainder of the flu season. And I think that's one of the things that we should really rally behind. Just with the paper that Aaliyah helped write, it was three out of 4 kids, I think it was, that died due to the flu. And that's something that you normally don't see in a developed country, right? And so I think if we need to advocate and really push CPB and Border Patrol agencies to really, that's something fundamentally if you want to reduce disease within detention centers. So when talking about the border, really rally behind that. So that means calling your representatives, really pushing for people, bringing it to light, encouraging people beside you to really take on these issues and to advocate for them. And I think in the long term, when you really educate yourself, because a lot of this problem rises because immigration, the United States has a broken immigration system. And so that literally forces people, and I'll give you an example. For example, like I could have my brother in Mexico and I apply for him today. I will not be bringing him to the country maybe 20 years from now. Some of the cases that people have submitted back in the 90s are still being worked on. So that means that if you're literally in a crime-infested area or you're starving and you have no job or anything like that, the likelihood of you waiting 20 years to come into the country are very, it's an innate reaction to want to leave that situation. And so long term, I think we really need to be advocating for a more just and more comprehensive immigration reform that really allows people to bring their family members in and that they don't have to take that dangerous journey all through Mexico or across the border to get here. So short term, like right now type of thing, the flu season is coming up. We want to protect these kids. We want to protect the detention centers. And we also want to protect the employees. If the employees are not, if they're going to be around this environment also. So you want to protect everybody. So really rally around behind this and really advocate for maybe just having flu shots for everybody in detention centers across the United States.
Great. Well, maybe that's a moment. I don't know, Dr. Sunerji, if you want to add to anything now that flu has been discussed here?
I was so happy to hear your point about children, about the importance of identifying sick kids in these centers, because I think after reviewing the autopsies, and I think that's what we saw. We saw that kids decompensated very quickly when they came to the emergency department, and although it's difficult to say whether or not deaths could have been prevented, surely identifying these kids faster could have made a difference. So on the notion of flu, apart from getting your flu shot and advocating for the flu shot to be given in CBP facilities, I don't know how much more I can add, apart from the fact that these deaths, the deaths from infectious diseases in children should not be occurring in any facility. And identifying sick kids faster is certainly a priority.
Great. Monica?
So thank you very much for organizing this event and for your perspectives. I just wanted to mention that the crisis, I had a question.
Introduce yourself to everybody here so they know you.
Of course, yes. Hi, everyone. My name is Monica, and I work at Centro Sol, the Center for Health and Opportunities for Latinos here at Johns Hopkins. I was one of the inaugural fellows for the Bloomberg American Health Initiative, too. So I wake up in the morning and I ask myself, how did we get to this crisis? How did this happen? Next year is an election year, so I encourage you, if you have friends, communities, neighbors who can vote, to register to vote, because that's super important to do all these policy changes that we're hearing today. And I just want to mention that there is the crisis at the border doesn't end there. It's not something that is happening far from here. It's happening here. It's happening in other cities all over the country. A few weeks ago, I received a call from a mom who was trying to become a sponsor for her daughter. She crossed the border in one of these huge trailers. She got skin burned because the trailer was super hot. She was detained in Texas and sent to Chicago. So that's across south to north. The mom was requested a lot. She's undocumented, and she was being requested required a lot of proofs that she can be a sponsor. Like, can you prove that your child would have health insurance when she arrived to you? That's just inhumane. This poor woman was really struggling to get her daughter out and sponsor her daughter. So I think the broken system needs to be changed, and next year is going to be very important. So if you can vote, you have the duty to register to vote. Thank you.
I'll open it up for other questions and comments. Here, April in the front. Maybe just introduce yourself.
Thank you so much for sharing your stories with us today, everyone. It was really informative. My name is Natasha. I have a question. So if research about the science behind trauma or the low likelihood of being granted parole as an asylum seeker can't inform effective policy, what do you believe the role of hunger strikes or public protest is in playing a convincing role for government officials to enact humane policies?
I think it's all about baby steps. I feel like sometimes I'm the first person in a room that probably experienced half the stuff that these people are experiencing, but just the fact that I am there brings this wealth of knowledge and brings light to a lot of the issues. So sometimes, and I get frustrated too, because sometimes I feel like climate change is real, guys. Like, if you haven't learned that yet, but still it's not translating to policy, right? And it's literally like, and I'll give an example, like when it comes to climate change, my roommate, just by having her around, she has encouraged me to make baby steps, right? And it's just that education that has really change the way that I think about certain things. And so even though we probably are not seeing the changes that we want to see when it comes to policy, I feel like providing that education to people around you, what it means, what it is, and encouraging those people to then speak to other people. And so that's how you educate, I guess. And sometimes it shouldn't be your job to like do that education, but sometimes a lot of people really need it. And so even though we're not seeing the change that we want to see, or if it's not coming fast enough, we're making little baby steps. And hopefully, if we have a lot of people vote the way we want to vote next year, we would see a lot. It would happen a little bit faster. So.
I think you touched on like the hardest part of what it means to be an activist and an advocate, because it's frustrating. It's like we can clearly see what's going on. What is going on with all of y'all? Like, one of the biggest things that I've learned is that folks in these environments are either not seeing the same points of view as we do because they have a different set of priorities. For example, I have a friend of mine who works in the defense industry, and you would think like, oh, defense industry, like military, whatever, they would never advocate for anything like this. But they actually submitted her firm and a couple of other firms submitted like a series of amicus briefs to bolster the case for why DACA recipients should be allowed to remain in the country. Their argument wasn't about humanity. Their argument wasn't about like, oh, these are people and they have to be here. Although it should have been, and it's frustrating that that wasn't the case. The argument was these are people that are financial assets. These are people that are coming in here and are providing a critical experience that the U.S. needs. So it's reframing the narrative, and it's frustrating because like we shouldn't do that. It should be clearly evident that the people should be here because they're human. Like there's no other way about it. But reframing the conversation around what the priorities are of who you're trying to change the minds of, that goes a long way. And again, it's frustrating that has to be done, but it's one of the ways that you can help shape the narrative and help them see things your way.
Other questions? Yeah.
I'm not quite sure who this question is best for. Probably. Oh, I'm Rachel, and PhD student. Probably more for like faculty of the school. But are there any plans for a coordinated, kind of touching on this point of like advocacy and the power that a public health institution has for a coordinated response from Bloomberg, from like any of the departments that students can get behind as well to voice our support for advocating for this situation?
Yeah, I would say there have been, probably the Center for Humanitarian Health has kind of been the lead working on this and has been involved in all these different letters to Congresswoman DeLauro and others that have been written. There's also a planned protest, I believe, in 2 weeks in Washington by health professionals. That's being organized by a number of different sites. But I would say that in addition to that, there are a number of other things that the school participates in through the Association of Schools of Public Health. It's been pretty vocal on a number of these different issues. And then individually, a number of us are quite involved with a variety of different projects. But I would think, maybe Paul, if you want to add to that.
Firstly, just to really, Josh has been the one that's leading this. The one thing that we're trying to do, and Catherine and other colleagues will participate in this, is to try to, a lot of people haven't seen migrants or refugees, and they don't understand really what it is, and they have these minds. So we're doing little steps, I would say, as opposed to a concerted effort. But on November 21st, and you're all invited, at the Baltimore City Library, we're working with Stoop Stories, which is a storytelling group, and we're going to have refugees, migrants, and faculty actually tell their stories in a personal way to reach out to people. And we're hoping to have between 300 to 500 people. There are little ways that we can, and Josh and I have talked about, but we haven't really been able to yet move forward on this, but to try to reach out to different groups, maybe schools of public health in the South and other areas that maybe don't have such an urban environment as Baltimore, to try to also work with them. But we haven't yet moved on that particular issue.
Yeah, I mean, I would just say that students who are interested in doing more on this are totally welcome. Email me. There are different ways that we can support projects. I think there have been a bunch of activities, and I think we'd be very open to more. Any other questions? Great. Well, if not, please join me in thanking. Oh, wait. Whoa, one more question. Okay.
Sorry. Thank you so much for this. This was very informative and definitely very eye-opening because someone like me, like I do not know much about this, but this certainly like piqued my curiosity. I am Harshini, and my question was like because I don't know much about this, but what is being justified as the need to separate children from parents? Like, how did that like start is my question. Like why, like if suppose you have refugee intake, like where, like if there's refugee intake, like what are they justifying as the need to separate them, or is that not justified by them at all and this is just something that's happening suddenly?
So I think I can answer this one. Official federal policy is that we're doing this as a deterrent to prevent folks from even thinking about coming to the United States, with the mindset that if the punishment for coming here is so inhumane, so severe, that fear is going to permeate to the rest of Central and South America, and folks are not going to come out here. And so that's like the mindset, like, oh, if we make it as inhumane as possible, like folks aren't going to come out here. Like, but we forget two things. One, that when your country has been devastated by economic despair, by gang violence, by warfare, you want to do whatever you can to get out of those environments. And ultimately that means risking your life and limb, sometimes literally, to come across these environments and seek what you have been told is the better place for you to be at. So that's one thing that folks forget, that, oh yeah, these can be deterrents, but like you have no idea what folks are going through in their home countries. The second part of it is that this is not new. I say that because we have seen historically that the United States is not this is not the first time we're seeing detention camps. So it's not the first time we're seeing separation of families. You have to go back only like 60, 70 years to see the incarceration camps from Japanese internment back in World War II. We're talking about folks who have had their children separated because they were native back in the 19th century. So these are historical patterns that are happening, and this is not the first time this is coming about here. So in short, this is nothing new, and they're justifying it as a way to like deter folks. Whether that works or not is still, it's not working clearly, right. But we need to do more to ensure that these patterns don't happen again.
Yeah, well said. I would draw a slight distinction with respect to the southern border. There was a new policy put in place. It echoed different policies in American history, but this was a very deliberate policy that was put in place, and I think Representative DeLauro referred to that. A number of us wrote a paper you can find or email me, I'll give you a copy, called Children as Pawns of U.S. Immigration Policy, and it goes through some of the history as well as this basic concept, and the argument is that it is immoral to use children as pawns of immigration policy because they're basically saying to families, we will hurt your children if you come over. That's basically the message in a child separation policy. So please join me in thanking our great panel, and thank you all for coming.